Hi friends, and welcome back to Health Made Simple, the place where we untangle the medical mumbo jumbo and talk about health like real humans. I'm your host, a registered nurse, researcher, and someone who's spent years in the ER and ICU. In today's video, this episode hits close to home. Recently, my husband was diagnosed with stage 2 hypertension. That means he'll likely need to start blood pressure medications. He's relatively healthy, so we were really shocked because he felt fine. So it got me thinking after his blood pressure diagnosis that a lot of people may not know they have high blood pressure, and it could be related to medications, especially antidepressants. It could be playing a role in your high blood pressure development. I think it's important to talk about because hypertension, it is preventable, so getting your regular blood pressure checked is incredibly important. Can antidepressants raise your blood pressure? If so, how do they do that? And what can you do about it? Millions of people are on antidepressants. Antidepressants are medications used to treat conditions like depression, anxiety, also even chronic pain. These medications work by adjusting the levels of neurotransmitters, chemicals like serotonin, norepinephrine, and dopamine. These affect your mood and it helps regulate your emotions. Each type of antidepressants targets these brain chemicals slightly different, which is why they can also have different effects on our body, and that's including your blood pressure. There are 4 main types of antidepressants or classes. One common one is selective serotonin reuptake inhibitors, SSRIs. The next class is serotonin norepinephrine reuptake inhibitors, SNRI. And the third is called tricyclic antidepressants, or TCAs. The fourth, the monoamine oxidase inhibitors, or MAOIs. Everyone's brain reacts differently with these medications. So don't be surprised if your doctor changes your medication or dosing, because one medication may work really well for one person, but not for the other. Now here's an example of how your brain and your body interacts differently with these classes of medications. For example, SNRIs increase levels of norepinephrine, a chemical that acts like a stimulant on the cardiovascular system. These neurotransmitters tighten blood vessels and increase your heart rate. What's interesting about norepinephrine is when I was working in the ICU, we used to give this medication to people who were critically ill that dropped their blood pressure so much that it was critical to bring their blood pressure up. So one of the medication that we would give is a medication called norepinephrine, which did exactly that. It tightened the blood vessel and increased the heart rate. If you're taking SNRIs, it does help with your depression, but it also has these cardiovascular effects. And these cardiovascular effects can lead to elevated blood pressure, especially at a higher dose. In contrast, SSRIs generally don't raise blood pressure and may even slightly lower blood pressure. And this is why understanding how each of these type of antidepressant affects not just your mood, but your overall physical health. It's so important, especially if you already have or are at risk for hypertension or high blood pressure. So let's talk about those class of antidepressants, SNRIs, that have those cardiovascular effects. So some of the common medication names are Effexor or Prestige, which are commonly described meds that not only lift your mood, but also give you a kind of a cardiovascular system jolt. But what's surprising is that you might not feel that jolt. So it's really important that you take your blood pressure. SNRIs, these meds work by boosting the two neurotransmitters, the serotonin and norepinephrine. Think of norepinephrine as like your body's internal caffeine shot, these neurotransmitters. These neurotransmitters, norepinephrines, they tell your blood vessels to tighten up and your heart rate to pump even harder. So what happens when you have too much of the norepinephrine? Well, your heart rate starts pumping harder and your blood vessels start tightening. And just like that, your blood pressure rises. And it's your body's stress response really in overdrive. Now I'll give you a real life example of what we just went over. I once cared for a woman in her early 50s who had started on Effexor, the SNRI, for depression. Now, initially, her blood pressure was normal, but a few months into the treatment, was feeling more anxious than usual. Her routine blood pressure checkup revealed that her blood pressure had rose to 150 over 90. Well, it turns out her dose had recently bumped up to 300 milligram a day, right in that zone where studies show up to 13% of patients can develop hypertension, chronic high blood pressure. Now, this case stuck with me because the medication was helping her mood, her depression, and that's really important. But her heart was quietly paying the price. So listen up, check your blood pressure, especially if you are on SNRIs. Studies show that people taking high doses of Effexor are about 1 to 5 or 2 times more likely to develop hypertension than those on SSRIs, especially when the dose exceeds 200 milligrams per day. If you're taking SNRIs, check your dose. And if you're taking over 200, maybe it's a good indication to check your blood pressure next time. Now, this risk highlights the importance of regular blood pressure monitoring, especially for patients on long-term high-dose regimens for the SNRIs. The next 2 classes of antidepressants, they're the older medications, so the SNRIs and SSRIs are more commonly prescribed. The first is the MAOIs, the tyramine time bombs. MAOIs were the very first class of antidepressant introduced in the 1950s. Now we'll go over why it's called the time bomb. They're prescribed infrequently, maybe accounting for only about 1 to 2% of all antidepressant prescriptions. The MAOIs are mainly reserved for cases of treatment-resistant depression when other options have failed or other newer medications have not done well. Now, despite their low usage, they remain a critical option in psychiatry for certain patients who haven't responded to newer medications. So look at your antidepressant medication and see if you're one of those few who are prescribed this medication. The MAOIs, they work by stopping the breakdown of these neurotransmitters and a chemical called tyramine. When tyramine isn't broken down properly, it can build up in your body and cause blood vessels to constrict, which can lead to a dangerous spike in blood pressure, hypertensive crisis. So when tyramine isn't broken down properly, it can build up in your body, in your system, and it causes the blood vessels to constrict, leading to what we call a hypertensive crisis, which is a dangerously high blood pressure. What gets kind of strange is that this tyramine is found in different types of food, like aged cheeses, red wine, soy sauce, cured meat. So basically anything that you impress your guests at a fancy dinner party. And cheeses and wine, I love those kind of foods. But if I were taking MAOIs, I probably will cut down on those. So what's the problem? These foods, when mixed with MAOIs, can turn your blood pressure into a ticking bomb. It accentuates the tyramine if you're taking those medications as well as eating a lot of these foods that we just listed. So be careful when you're taking MAOIs. Go ahead and, if you're taking antidepressants, know which class of antidepressants you're taking. So when your MAOIs block the breakdown of these tyramine, these chemicals accumulate in your body. It causes that hypertensive vasoconstriction crisis. Some people may be asymptomatic, meaning even if they were at a hypertensive crisis and their blood pressure was well over 250, the top number, they might not even show any symptoms. I had a participant in my study where her blood pressure was well over 250 over 90 when I took her blood pressure. Didn't really feel any different than normal, but she did feel a little bit of lightheadedness. And that is one of the symptoms that you may show if you go into the hypertensive crisis. It's important to address because it is a risk factor for stroke. So if you're taking MAOIs, consider taking your blood pressure at least once a week. What are some of other symptoms that you might experience during a hypertensive crisis? It could be severe headache, chest pain, blurred vision, and a stroke. But some people may not feel anything until it's too late. Now, the last class of drugs is the TCAs, the tricyclic antidepressants, or TCAs. Are older medications that used to be the go-to for depression before the SSRIs and the SNRIs became more popular. While these medications are prescribed in some cases, particularly for chronic pain or sleep issues, they're not as commonly used today to their more intense side effect profile, which we will go over now. The most notable side effect is orthostatic hypotension, which is a sudden drop in your blood pressure when you stand up. And it feels like you've been hit by a wave of kind of dizziness, sometimes even cause fainting. And here's the science behind that orthostatic hypotension. Interestingly, the TCAs block what's called the alpha adrenergic receptors. And these receptors normally help your blood vessels respond quickly when you stand up quickly, keeping your circulation steady, balanced, and preventing sudden drops in your blood pressure. Without this signal, you can imagine what happens. Your blood pools down your lower body when you stand up, and that causes dizziness because your blood is not perfusing evenly to your brain. It's especially risky in older adults who may already be struggling with balance, maybe slower reflexes, or if you have underlying cardiovascular problems that can make sudden blood pressure drops, that could even make this situation even more dangerous. Even something as simple as getting up too quickly from bed or a chair could increase the risk for injury if your blood pressure drops suddenly. I have a friend who has orthostatic hypotension. One of the things that she needs to be careful is the sudden drop in her blood pressure. So she's really mindful of when she needs to get up to take it slow. So let's talk about the SSRIs, the safer bet for blood pressures. Some of the drugs are Zoloft and Prozac. SSRIs are the most commonly prescribed antidepressants today. And they're typically gentle on your blood pressure. Unlike the SNRIs, they don't significantly boost norepinephrine, the chemical that can raise your heart rate and blood pressure at the same time. In fact, some SSRIs may slightly lower your blood pressure, particularly in individuals with anxiety-related spikes. So SSRIs also tend to have a milder side effect profile and are generally better tolerated, especially in older adults or those with cardiovascular concerns. That said, no medication is completely side effect free. But when it comes to balancing mental health and heart health, it appears that SSRIs often strike the safest middle ground. And in one study published in Drugs and Aging, SSRIs were associated with a significantly lower incidence of cardiovascular side effects compared to TCAs and SNRIs. A systematic review in the Journal of Clinical Psychiatry found that SSRIs, like sertraline, had the most favorable safety profiles in geriatric patients, particularly in terms of blood pressure stability and, fall risk. What happens if you develop high blood pressure on these antidepressants? When a patient develops high blood pressure after starting an antidepressant, first recommendation is to assess whether the medication is contributing to that change in blood pressure. Here's a typical step-by-step approach that clinicians will follow. And the number one being, monitor your blood pressure regularly. If your blood pressure rises after starting or adjusting your antidepressant, your provider will likely monitor it over several visits. And this is why a follow-up visit is super important when you're on antidepressants. Another option that your doctor may say is switching the classes of drug you're taking. So if you're taking an SNRI, they may suggest a SSRI, which has fewer cardiovascular effects. It's particularly related to blood pressure. You can also add a blood pressure medication if the antidepressant is essential to your mental health and blood pressure remains elevated. So before we take effect on changing our medication, changing our classes, or including antihypertensive medications, this should really happen after you evaluate lifestyle changes. In short, treat the underlying causes, really not just the number. If your antidepressant is raising your blood pressure, it's not just about throwing another pill at it, in my opinion. It's about finding a balance that protects your mental health and your heart, because you need both to be healthy, right? Because long-term health means treating the whole person, not just the isolated symptoms. So now, let's say if you needed to change your class of medication from SNRIs to, let's say, SSRIs. Well, one kind of challenge that you might face is that it may be very difficult to come off of the SNRIs. The SNRIs are one of the hardest antidepressants to stop. SNRIs and the TCAs are often the harder to wean off due to significant withdrawal symptoms, also known as antidepressant discontinuation syndrome. The symptoms can include dizziness, nausea, insomnia, fatigue, anxiety, and the infamous kind of the brain zap. Sounds like the long COVID symptoms. So in particular, SNRIs like Effexor are among the most difficult to come off of. One of the systematic reviews published in Addictive Behaviors reported that up to 50 or 60% of patients discontinuing SNRIs experience withdrawal symptoms, with many describing them as severe. Now, why are some medications are difficult to discontinue? So one of the issues with SNRI, it has both the dual action on the serotonin and the norepinephrine. Well, when it's a short life, that means these medications don't have effect on these neurotransmitters in a long term, but in a very short time frame. And that means there is less gradual weaning off of that medication. Reports indicate that that's why these medications are difficult to discontinue. So whereas SSRIs, especially Prozac, they tend to be easier to taper off because of their longer half-life, which allows the body to adjust it more gradually. One important note as we come close to the end of this video is that depression isn't usually cured per se. It's kind of managed over time. And that's why it's important to taper these medications under medical advice and supervision to avoid any relapse or minimize withdrawal symptoms. While not everyone will need antidepressants for life, some people may benefit from long-term or even life lifelong treatment, especially if they've experienced multiple relapses or chronic severe symptoms. How do you know if it's time to continue or taper off? Well, this is a conversation best had with your healthcare provider. There is no one-size-fits-all answer, just a shared goal of well-being that honors both your mental health history and your future. Why does this matter to me? A personal story, like I said earlier, my husband's recent blood pressure reading came at stage 2 hypertension. We were both shocked. Now, he's not on antidepressants, but had really gained a significant amount of weight. And weight gain is also associated with antidepressants. It reminded me, though, that there are multiple small factors like weight gain, stress, or side effects from common medication that can quietly add up and increase your blood pressure without, us noticing it until we take our blood pressure. Medication we think of as safe can have a ripple effect. So as a nurse and a caregiver, I've seen firsthand how small changes, a different med, a missed checkup, new stress can tip the balance from health to disease. So this video is my way of saying, check your blood pressure even if you feel fine, whether you're taking your antidepressants or not. But if you are on SNRIs or MAIOs, antidepressants are powerful tools for mental health, but they're not without side effects. Studies have shown that high blood pressure isn't just an issue for older adults. In fact, recent study from CDC found that nearly 1 in 4 adults aged 18 to 39 with hypertension were unaware they had it. They had no knowledge. That means younger people, especially those on medications like antidepressants, might be walking around with elevated blood pressure and not even know it. So please ask questions, know your numbers, and be kind to yourself on this health journey. And speaking of kind to yourself, my husband, who is overweight, we think the weight is a big contributor to his high blood pressure. So one of the goals that we have is for him to lose his weight and recheck his blood pressure in 3 months. Because if the weight is something that is causing his blood pressure to increase, we can make these lifestyle changes so he doesn't have to take those medications. So watch for those videos in my husband's journey to lose the weight and keep his blood pressure down. Thanks for watching Health Made Simple, the channel where we make health real, relatable, and dare I say simple. Give it a like, share with someone who needs it, and hit that subscribe button. Take care of your head, your heart, and your whole self. See you soon.